Question number 2, if we know the bacterial organism is Borrelia, why can't we just treat it with an antibiotic and expect it to be eradicated? Well, first off, Lyme is a clinical diagnosis and there's lots of different strains of Borrelia. The original described Borrelia was Borrelia burgdorferi sensu stricto, which is the one that was isolated in Old Lyme, Connecticut back in the 1970s. However, in Europe, there's lots of different Borrelia species, not just Borrelia burgdorferi, but Borrelia guerini, azafrei, spilmanii, and avariensis, and most recently, Miyamotoi. So any of these bacteria and other bacteria can be biting people, or the ticks can be biting people and inoculating those bacteria. Fortunately, all of these bacteria are responsive to the same antibiotics if you catch the disease early. So yes, you can treat Borrelia with antibiotics. There's different strains of Borrelia. The testing doesn't always pick up the different strains of Borrelia. But if you see somebody who has a tick bite, who has clinical manifestations following the bite, or if they have a rash, you don't need an antibody test. You just treat with the appropriate antibiotics. And there are guidelines for treating with antibiotics. And if you catch these infections early, most of the time, the infection can be cured. The challenge is, what if a patient shows up 2 years later, haven't had a tick bite 2 years before, and is chronically unwell because of chronic Lyme? That is the challenge. It is not recognized that there is such a thing as chronic Lyme, despite lots of data to support from PubMed that persistent chronic Lyme infections and other tick-borne infections do exist. What is the duration of treatment for these infections? We actually don't know, because no study has ever been done. With other chronic infections, if you, for example, chlamydia, pneumonia, chronic arthritis, if you catch the infection early, you can treat with a short course of antibiotics. If you catch it later, it requires up to 6 months of combination antibiotics. But there is no such guidance on the treatment of Borrelia in terms of diagnosis, in terms of duration of treatment. So until we have a better understanding of these infections, the guidance really should be treat people until they are better. Don't be prescriptive in terms of a set treatment course, i.e. nice guidelines say you can only treat for 3 weeks. If you treat for 3 weeks and they get better and they stop, for any other infection you would treat for longer. And I think it makes common sense, until there's good controlled studies, that we should treat the patients, not the guidelines.